Good afternoon, dear participants of the press conference. Today, we continue a series of events carried out by AIDA Center together with RPR. The events that are aimed to dismantle the myths around reforms and to speak about the reforms that are carried out by the government. And today we are going to speak about medical reform that raises a lot of concern in society, and whether it will be for payment, what will happen in rural areas, and why it is still not signed by President, and what are the challenges in the implementation. And today we have Ulana Suprun, Acting Minister of Healthcare of Ukraine, Serhiy Berezenko, People's Deputy of Ukraine, and he supported the draft law of the Parliament, Oleksandr Yabchanka, our Reanimation Package of Reform Group's expert. And for half an hour, we will have speeches of our speakers, and then there will be a Q&A session. Good afternoon. Thank you for coming. Thank you for organizing such a wonderful meeting. So the first step in the medical reform was done. This was voting in the Supreme Council, draft law 6327, and there are still some procedures, and the President should sign the draft law to become the law, and we won't stop, and we speak how we are going to implement the law. And often in Ukraine it happens so that we adopt good laws, but if they are not implemented, they do not act. So the law on urgent medical help, that there should be emergency room in each hospital, but this was the law of 2012, but this was still not properly implemented, and in 2018 we will change the system of financing at the primary level, and there are for general practitioners it won't happen in one day, and not everything will be changed on the 1st of January, but we will gradually shift to the new system. And the treatment in hospital and in polyclinics, it won't change on the 1st of January. Only it will remain the same, and starting 1st of January 2020, we will change the system of financing at this level. So all these questions about the tariffs for operations, now we do not speak about tariffs now. Nothing changes in this level. Now we are only speaking about primary level, about family doctors, and at this level, starting 1st January, and even now, we all need to find our own doctor. Yesterday, I traveled in the taxi. I go by taxi and I spoke to taxi drivers. They are from different parts. Taxi drivers are from different parts of Ukraine. They ask questions, and one of them said, "You are minister, so whether we will have medical insurance." And I explained to him the medical reform, and he said that he didn't understand this, but his children, they understand this, and they are 25 years of age. And I said, listen to your children, because young people understand what insurance means. They travel to the West, they have different views, and my first advice, listen to your children. Second, now we should not speak about hospitals and specialists. We do not change anything, and we are speaking for 2.5 years about primary level. There will be a transition period. We won't be and all Ukrainians will sign the contracts with their family doctors and laboratories and first aid centers and physical persons, entrepreneurs, doctors who have their own practice. They should first create conditions in order to sign the contract with the state insurance service. They should be able to sign these contracts, and the centers, they should change their legal status in order to be autonomous, not commercial enterprises, and this will take some time, and then they will be able to sign the contract with National Healthcare Service and get another type of financing. And doctors can become physical persons, entrepreneurs, and it will be easier for them to work then. And we all should find our own doctors, so it will take time. I saw many interesting articles, and journalists said how to find your family doctor, and you can look on the site of the Ministry of Healthcare. Patient organizations also create ratings of doctors in order that we know what doctors are the best. And also we had a meeting with the regions, and we asked them to create a system on their site in order to show to the patient where the closest doctor is, in order that people were able to find the doctor. And the taxi driver I spoke yesterday, he said, I found my doctor, but my wife found another doctor, and he asked whether they can go to different doctors. Yes, you can all have different doctors, or you can visit the same doctor, and you are not connected to the place of your residence. You can go to any doctor in Ukraine. If you live in Lviv and you want to go to Kiev to your family doctor, you can go to Kiev, but it won't be beneficial to you. But you can sign the declaration with any doctor you want. When you come to your doctor, you can get services free of charge that are identified by the state. So these are appointments with the doctors, the certificate of leave, and basic analysis of blood and urine, and there is a list, and later there will be, and here we have a special book, and the materials are presented there. So these are the services. You shouldn't pay anything for them to family doctor. And the same taxi driver said, but I got accustomed to pay to the doctor, but the doctor should not take money from you. And if he takes, do not give money to your doctor, because this is covered by the state, and money will go to the doctor directly, not from some oblast council, not from through some chief doctors, but just directly the money will go to the doctor. Do not pay to your doctor, and I would like do not pay a doctor. So please get information from the primary source, from the ministry, and read what the ministry writes, and when the journalists address the ministry and provide their given answers to their questions, because there are a lot of lies, and the truth is there, and it is clearly stated with the simple words in on my Facebook page and on our ministry's website. The information is presented by Oleksandr Yabchanka, who travels around Ukraine and tells how it will be done from behalf of our RPR friends, and also If something looks suspicious, please address our press service and ask whether this information is true or not, and we will give you correct information. And do not write only one-sided information, write the truth. It is important that we convincingly presented the truth, everything that our citizens need in order that they understand what is going on. Because our citizens, they have fears like they have when pension reform was discussed. And for a month, we see that people have their pensions increased, so the same will be with the health care. So financing is based on the NHS system, and one of the, like in Great Britain, and the law of Ukraine is as of 1946, but it came into force 1948. So 2 years, for 2 years, all associations were against. Half of politicians also were against, and they called the Minister of Healthcare the Führer, and because this was after the Second World War, and this was like the end of the healthcare system. But in 1948, when it came into being, 2/3 of citizens of Great Britain signed contracts with their doctors, and the biggest medical association came up with the press release, and they said that this is correct, and they supported the healthcare reform. So this process of questions, fears, myths, this was in the past, and it will happen in the future. This is a normal process. We shouldn't fear, but ask questions in order not to have such myths. And instead of speaking about the myths, we should speak about the truth. Thank you. Thank you, Ulana.
Thank you, Ms. Ulana. Mr. Serhiy, how the draft law was in the process of voting in Verkhovna Rada? We saw that, and the committee had very strong debates. What will be with the reform, and what are the plans for future? Thank you for inviting me. First, the voting on October 19th. If it is not the most important, then it would be extremely important voting. This reform would be implemented, and after its implementation, we will have critical changes in the healthcare system. The emotions you saw, our emotions after the voting, I was surprised that our optimism was not shared by very many Ukrainians when we are on talk shows or in the streets. What are the reasons why the major share of Ukrainians, not the major share, but large share of Ukrainians do not believe into this reform? When we explain how simply, how easy the reform will be implemented, and doctors will become interested in providing high quality medical services to patients. So I think this is the will of some cunning politicians to gain some score on this, on blaming this medical reform. Now everything is mixed up in the views which have been proposed by different politicians. So such briefings, and I would like to thank RPR and ADA Center for this discussion, because it would allow to dispel the myth related to the reform. So when the law was voted for, then now, after the voting on 6327 draft law was positive, now the Smiths, they try to discredit the reform, and MPs were so far in their reflection that at the end of the discussion with any opponent, this MP, they tried to persuade that the healthcare services would be paid. This means that these politicians either distort the clauses of the law intentionally, or they just have not read it. So I'd like to stress and accent that there are no paid health care services at the primary care institutions, and palliative care is also included, and the deliveries and the emergency care, the whole set of services besides not urgent dentistry. All those services would be included in the guaranteed package of services to be provided to patients. As concerned the free of charge healthcare system which we have now, it is double lie. You saw those videos about the explosion near Espresso TV channel where a woman was wounded into the head, and every video plot was finished with calls to the population to bring money for provision of surgical operation to a woman wounded in the accident, because 15,000 hryvnias, which the relatives of this woman brought to the hospital, they were the only their savings. So there is no free of charge healthcare system in Ukraine, and Constitution Article 49 is not complied with. Well, the funding which we found means that we redirected cash flows. Yeah, this is true. We have redirected with time. Ms. Ulana and the ministry will offer us a model operator of the funds, a holder of the funds, but they will not be going through institutions of healthcare systems at local level, and executive authorities and local self-governments. Now medicines would be purchased based on the decision of a hospital itself, because a hospital is really interested to pay good salaries and to buy medicines at lower prices. Of course, the Semashka system, which was introduced after the Second World War, it was via dividing the population into several groups in order to provide them some aid. Now the world is developing, but everything which is present in the entire world, it is lacking in Ukraine. We are the fourth in the world by the number of hospital beds, with 30% of hospital beds being in use. So 2/3 of healthcare system funding they go for district heating, for maintenance of the hospital buildings, and salaries and wages, which are minimum and do not grow. You would be even more surprised where the area of hospitals, it is 40 million square meters. Our healthcare system buildings and facilities, they have 40 million square meters of buildings. But now the patient would be the core, and the doctor would be interested in finding his or her patient. This would not be us who would seek for a doctor, for a good doctor who is capable not to ruin health but to provide high quality services. This year we are talking this and next year we are talking only about the primary care, and the very important formula of salaries accrual is introduced. It would be as of June of the year of calculation, so 15,000 hryvnias conventional. The salaries of doctors would be minimum 15,000 hryvnias. Now a cardiologist gets salaries of 4.5 thousand hryvnias, so their salaries would triple. In all the world, in all developed countries, 8% of GDP are used for healthcare system. In our case, we will give 5% of GDP, not less than 5%, for implementation of this program. There are other programs such as affordable medicines and other programs. They will continue. They will continue their implementation. And we are now attaining a kind of European level, the level of European Union countries. Nothing will be possible without the implementation. There are great hopes in the society, and the opponents now hope that we would fail if we use blaming policy. So I am eager that we continue working about the primary aid. When we implement reform for the primary care successfully, then we will switch to the secondary and tertiary care institutions and their funding. As Ms. Suprun said, she gave us an example of Great Britain. I hope we will follow their best practice. And we need strict monitoring on the part of public, on the part of MPs, an authorized body which will be in charge of funding and which is not yet established but to be established. It would be supervised by auditor service, by accounting chamber, by the National Anti-Corruption Bureau. and all of us are interested in no violations and abuses in the use of funding in this new authorized body, so that the cabinet or parliament do not blame us in some interest, vested interest in this body. So thank you. Of course, public control is important, but also public initiatives, civil society initiatives were very important in the developing of this reform. When Oleksandr Yabchanka came from Maidan, he proposed the idea of reforming the healthcare system. We were skeptic about this, but for his birthday, after 3 years, he got this birthday present. Thank you, Victor. I would say that my role is minimum here, as many people here in the audience. I just want to have normal, adequate healthcare system in the country. When this development of this reform started in 2014, there were very many other reforms on the agenda. All of us earlier or later become patients, so understanding this, we understand that healthcare system is our system. How the policy has been changed in the healthcare reform system. This portion of reform is not discussed broadly. This would be a case study to be demonstrated to other ministries. A full cycle of public policy making, you should just articulate it to those who it concerns. So you can articulate it to all stakeholders, and all the population are stakeholders in the healthcare system, because every person suffer this or that disease. The third category is the self-governments. And finally, to get legal grounds to implement this reform, the draft laws should have been passed this year, starting with January. Directly, the minister, her deputies, they were on visits with us in every regional city center. You can't imagine what was happening there. People wanted to talk, and they wanted to listen to the information, and at the same time it was very surprising that when the minister visits you and ask you about the reform, so the history was, the story was that you come, you present your vision and ask. This was how the minister behaved, so it was very surprising for our people. 63 cities have been visited this year. All the stands were registered by policy analysts of RPR component organization. They proposed to make policy in the manner used all over the world, and the Ministry of Healthcare agreed. Now these stands, they are registered, recorded, and they are provided to the ministry, and the ministry then decides. So you have now the primary consultations deliverable in the form of brochures in your hands. This is the deliverable of our tour 1. It concerns the system of funding. What the ministry is doing now, we are making our visits and we are holding consultations on specialized healthcare services provision. 2 years of preparation does not mean thinking. This is not just thinking, this is visiting places and discussing the reform, how it should be implemented. The results of the tour on the part of those who are the most important link in the system, patients. Patients patients are just tired, that they do not know what would happen when you get sick. The same concerns doctors. Doctors are also very tired to be in the role of askers or racketeers. They should either ask for money or to press on persons to get some money. This is the situation as it is when a patient gets guarantees which are predictable, and doctors would get salaries also in predictable amounts. For the reform to be implemented, everyone should do his job or her job in an adequate manner. Patients should hear to the doctors. Doctors should become interested in providing high-quality services. The cabinet should create incentives, financial incentives. They should be legitimized by subordinate legislation, by secondary legislation, because the primary legislation is already in place. And I would like to address journalists and mass media. Please cover this reform. Thank you for the mass media to cover this reform in high-quality manner. They want to get answers to their questions.
Interfax Ukraine, Anna Levchenka. I have such a question. Yesterday I was asked by accountants. They often ask about the reform. I told them about the reform, but accountants, they asked 15,000 hryvnias. This is included, taxes included. And how the issue of taxation will be resolved, whether they will pay taxes, and if they have 15,000, what will be left for them after taxes are paid. The answer is evident. His family doctor will be a physical person, entrepreneur. They will pay single tax, and the maximum. So we for 2018 we have we will have more than 300 hryvnias per patient. So this is 740,000 hryvnias per year. So they will pay 5%. This is the maximum tax for this category. And about the money, the tariff, in the there will be proper calculations. Also, there will be salary, medicines according to clinical protocols. The diseases will be treated according to these protocols, but this money will go into hospital. So we should pay a dignified salary to a doctor, and by this law we oblige the Cabinet of Ministers to include this high salary in the tariff, and if the doctor gets official salary, he should pay a single social contribution to pension fund, and also to pay a tax. Profit tax. So about the institutions, they will be reorganized into communal, non-commercial enterprises. They will be non-profit enterprises. Non-profit enterprises. So the taxes in such a case will be for them low. Olga Kupriyanova, Zdravin 4 news outlet. First question: why there is a delay of signing of this law by the president, and whether the service have been already created? So, as the deputy head of Petro Poroshenko Bloc, I would like to say that the president is not to blame in this case. There is a procedure, and each deputy, after voting for one another law during second reading, when the law can be signed by the head of the Supreme Council and provided for the signature of the president, there can be a procedure that can appeal against the adoption, and several colleagues made it on Friday when the session, the plenary session was at its end, in order not to bring this issue for consideration. If there is such a provision, there is a direct prohibition to the head of 226 deputies may cancel this decision. I believe there won't be 226 deputies, but we have a delay until 27th of November, until 7th of November, and this provision will be introduced into the whole. I believe it won't be voted for, and then I believe the president will obligatory sign this. So this resolution was prepared, and we discussed it, and the creation of this operator fund is envisaged by law. When the law is signed, then we will provide these legislative acts through the Cabinet of Ministers, and then we will sign it in the ministry. So these documents are prepared, but we wait for this administrative procedure to happen. Irina Markevich, 1+1. I understand that I have a question not about the primary level, but for prospects of the tariffs issue, and I spoke with the chief doctors about about the tariffs. What will this tariff consist of? Whether these tariffs will be the same, whether operations will cost the same in different levels, if we take into account different places, different taxes, and for whom is this tariff envisaged for?
Who will be ensuring this tariff? Who will fund it? It would be the National Medical Service. Tariffs does not mean that they should be payable by population. State budget will pay this services for. Special budget would be provided every year, apportioned every year. In the treasury, it is on the account of our population. National service of health care, it will pay. So, and I think Oleksandr can answer. There is how the Cabinet of Ministers now has pending the procedure submitted the procedure of calculation. It is submitted already to the cabinet and it is pending there. I would like to give you more details. Just imagine there is a hospital. It has first clinical department, the second is diagnostic department, and the third is administrative department. So this expenditure should be divided and assigned to the cost of services, including utility bills. Everything will be included into the cost. What is important? The cost of work of medical staff. Doctors, they are interested in salaries. This would be 50%. Doctors should stop being afraid of white salaries, not shadow salaries. They are afraid that they will not earn so much money. When we tell them about 550%, they agree. We need time to calculate the cost of services. For example, there are two hospitals. They get equal funded because the number of visitors is the same. But the first hospital, for example, provide 1,000 surgical operations, and the second provides half of this number. So they provide different amount of services and get the same payments. The tariffs will be uniform, single for the entire country. Let's ask our society. We have 2 years to make a decision. The main thing is when we know to calculate the guaranteed package of services, we need several indicators, such as the need in services and other. At the end of 2019, we will be understanding the cost of services and the need, the demand. Then the Verkhovna Rada, the parliament, will vote for specific guaranteed package. Then MPs will say voters that will vote for this package if they want to increase it. Why should we compare the services of governmental medical institutions but not private institutions? Yeah, the cost of services differ in private and even in budget-funded institutions. So within one overnight, we can't calculate the cost of medical services. We do not have a real cost of services now. As concerns state-owned institutions and private institutions, National Health Service of Great Britain will differ from our Ukrainian, which is to be established. A patient will have the right to choose a doctor. For example, a surgical operation will cost conventionally 10,000 hryvnias for some surgical operation, and in private hospital, you can go to private hospital, you will be paid 10,000 hryvnias by the state from the budget, but you should be adding some added payment for better conditions in this private hospital. As concerns are the communal payments. In district hospitals which are not so big, they would provide less services because they have a lower number of population than in Kiev, for example. So percentage is low, but it would anyway be more money. We should think as businessmen. This is an enterprise, this is a business entity. How can we accumulate enough money, save enough money to pay salaries? We provide services, we are service providers, and we want our clients to be satisfied and healthy. When they're healthy, they would be satisfied. And everything would be paid from budget according to the tariffs. Olena Shpilkievska, Trade Union of Medical Staff of Ukraine. We protested recently. We held an action in which 4,000 medical staff members took part. The draft laws and the laws passed, they do not allow us to work. Health is not business. What is the question? I would like to ask about the salary debts. Debts on salaries to medical staff. Doctors. How many doctors outflow to other countries? Interns' salaries are 3,200. What corruption we are talking about? How can we live on 3,200 hryvnias? We have all calculations. If you need it, please call me Olena Shpilkievska. Thank you. As the situation does not satisfy anyone, you can ask me. I would like to answer. We had a meeting with the trade union 8 times, and I was present at the conference in the trade union. And our deputy minister, Kovteniuk, also visited their meetings. And we were discussing the medical system reform, and they agreed that salaries of doctors should be increased, and we proposed the method how to increase medical staff salaries. So we are communicating. When a person asks, and maybe this is not a question, this is just a provocation, I think. Colleagues, I am a doctor. I have been working as a practitioner for 8 years. And this is a trade union which should stand for my rights. Previous 25 years, they have been fighting for my rights so good that my salary was 3,000. Now we can see that the things can change, and now those who have been fighting for us, they again are fighting for us, but I am against them because I don't want to have such supporters fighting for me this way. I was at the meeting where strange things happened when our guy was asking, why are you spending money? Why are you giving money to your Protestants? Why they are paid protesters? Next question, please. Alexei Vorontsov, Ukr-Press-Inform. When the law on family health care would be passed? It has been voted in the first reading already. In 1 week, the comments would be included in the form of amendments. So next session week, I suppose, now we are in the process of 2 weeks when MPs visit their regions, and 2604 draft law and the draft law on rural health care, which is important for the reform to strengthen not only care in cities and regional centers, but also to help to computerize, to provide telemedical services in rural area. This law 6604, it would be also finalized with incorporating the comments after the first reading, and its second reading will take place. Rural healthcare institutions were provided 4 billion hryvnias. They are on transit accounts in the Ministry of Regional Development, and now the Ministry of Regional Development, Ministry of Healthcare are developing the model of providing the opportunity to give housing to doctors in rural area. This way, we address 3 issues. First is provision of housing, second, provision of salaries to rural doctors, and the third is the provision of the opportunity to develop career development, professional advanced training via internet. Katya Ptashka, Ukrainian interest. I am interested in what patient should do if a doctor has refused to provide him services because the doctor has many patients already, and what to do in villages where doctors already have more than 2,000 patients assigned to such a doctor. Talking about villages, I mean, there is some specifics. In rural area, the probability that patients, density of population is lower. The other thing is that there are cases when in rural area doctors are lacking. There's 2 draft laws. The first concerning financial affordability, that's the draft law 6327, provides financial interest to the doctors. The second draft law is about not adequate conditions, creating them for rural doctors. So, the first part of your question I can answer the following way. In cities, there are more patients than in villages. So institutions are interested in having patients, and if they do not have enough doctors, then they can take a young doctor to fill vacancy, give him basic salary of 7,000, for example, and tell him that your 7,000 will grow thanks to the number of patients which you can accumulate yourself, which you can provide services to. Thank you to our speakers. I would like to sum up. The next year is a transit year. We have many questions concerning the implementation. So I would like to call on you to help us to implement the reform.